Hello friends, I am Dr. Himanshu, chest physician. Today I will be talking about bronchial asthma. Well, this is my contact number and today we will be talking on this bronchial asthma in three parts: introduction, main and conclusion. Have you seen any patient or any person having difficulty in breathing or difficulty in having a breath or choking sensation or having a whistling sound from his chest? Have you seen any person like this? Is it asthma? Now let's see in the main. Bronchial asthma is a medical term. In a layman's language, it is called as asthma. Now, according to World Health Organization, asthma is a chronic inflammatory disease with cluster of respiratory symptoms such as shortness of breath, chest tightness and wheezing occurring in varying intensity and in duration and with a variable expiratory airflow limitation. This is a definition of asthma. Now, according to WHO, there are around 300 million of people worldwide which are affected due to this asthma. In India, there are 15 to 20 million of people. Now, let's see what are the factors which are the causative agents of this asthma or the trigger factors. These are the pollutants, the dust, the smoke, the mites, the allergens. Also, the changes in the weather and foods we eat, additives, drugs. These are some of the causative factors or also known as the trigger factors or the host factors of asthma. Now we will see what are the types of asthma. These are extrinsic asthma, intrinsic asthma, steroid resistant asthma, occupational asthma, exercise induced asthma, cough variant asthma, nocturnal asthma, difficult to control asthma. These are some of the types of asthma. Now we will see what exactly happens in the lungs and leads to all these clinical features of this asthma. In our lungs, our respiratory system is divided into conducting zone and respiratory zone. Asthma is a disease of this conducting zone. Conducting zone means what? Means it is a connecting passage or the connecting bridge between the external environment and the respiratory zone. And asthma is specifically related to this bronchi. That's why it is known as bronchial asthma. Now, this asthma, the airways are lined inside by special type of cells. These are some special cells. When these trigger factors come in contact with these cells, these get irritated, and due to this constant irritation, because of these factors, the cells get inflamed and these cells release a specific type of chemicals, and these chemicals are known as mediators in our medical language. And these mediators are histamine, prostaglandins, chemokines, cytokines, etc., etc. But because of these chemicals is what happens is congestion, bronchoconstriction and bronchospasm, because of which we get chest tightness, coughing and difficulty in breathing. So, we have seen up to the clinical features of asthma. What about the diagnosis? Well, for the diagnosis, we need to ask the patient about his symptoms, about the frequency of his symptoms. How many times he is getting the symptoms in a year, in a 6 monthly or in a monthly interval or in a week or even daily. And how is the intensity of these symptoms? Whether he is getting these symptoms and he is even not able to carry out his daily activities, or he is not able to get out of the home, or he is getting bedridden. Also, we need to ask the patient about his family history, about his parents, about his grandparents. Were they suffering from this asthma? And also, we have special tests such as the pulmonary function test or the peak expiratory flow test or the nitric oxide inhalation test. Considering all these features, his symptoms, his family history and all the test results, then we can conclude a patient as asthmatic. Now, we have diagnosed the case. Now what's the next step? Obviously the treatment. Well, the current mainstay of the treatment for asthma is inhalers. These inhalers are short acting, long acting, and also combination of the steroid inhalers and beta agonist. Basically, what is the inhaler doing in the conducting airways? It is relaxing these pathways, because of which the airway caliber is increased, the inflammation is reduced, and the person feels relieved. He can breathe out easily. Asthma is a disease where a person is getting congestion and he is not able to exhale his breath easily. Also, we give anti-inflammatory and anti-allergic medications. Well, although it is said that asthma can't be cured, but I say that asthma can be well controlled to a level being extinct. How it can be controlled? We can use protective mask while going outside. Also, people who are working in a factory or other environments such as the mining or other factories, they can use this protective mask. Also, we can do breathing exercises like pranayam, kapalbhati, certain deep breathing exercises. And well, from my experience, after doing this regularly and consistently, I can surely say you that asthma can be very well controlled, and it enhances our immunity as well as our lungs capacity. Thank you friends. Hope you like this video and hope you like this video and this information. Thank you friends, and hope you for a better and healthy future and healthy life ahead. If you have, be watchful about your symptoms, and if you have these symptoms, don't delay. Please kindly visit a good medical practitioner and feel free to contact me on this number. Thank you friends. Thank you very much. Thank you.